Hello everyone. Today we'll be presenting our group project. Our topic is utilizing crowdsourced public health records from social networks for evidence-based diagnostics. Our group members are Jeffrey, Ryden, and Oliver. Here you can see the outline for our presentation. It follows the critical reading questions that were discussed earlier this semester. And we chose this outline because it allows us to go through the entire project but also not get too detailed and lose the audience in details of the algorithm and so forth. So let's move on and talk about the problem statement. So what is the problem? Classification is a well-established problem. It is important to be able to find differentiating features between classes so that a model may be derived that can classify unknown instances accurately. This problem is even more critical in the domain of medicine, where physicians are constantly bombarded by an overwhelming amount of data. In today's medical climate, misdiagnosis of patients due to information overload is a common occurrence. To further compound the problem, privacy concerns over medical records foster conditions where free access to data is not always readily available. We aim to utilize crowdsourced public health records acquired from social networking sites such as patientslikeme.com to classify patients' instances based on reported symptoms. The intent is to predict a patient's medical condition based on a body of evidence contained within previously experienced cases. So, for the main problem, we focus on two main aspects of it. For the input, we'll provide a list of symptom attributes, and the output will try to get a diagnosis classification. What's the importance of this topic? Misdiagnosis of patients in the healthcare industry is a substantial problem. It leads to tens of thousands of deaths per year, increased number of medical malpractice lawsuits, and an inflation of an overall cost of healthcare in our country. As stated in a recent article in the Journal of the American Medical Association, cases of delayed, missed, and incorrect diagnosis are common, with an incidence in the range of 10% to 20%. For this reason, the development of a decision support system to assist medical staff in the diagnosis process is important. If a system can be developed that extracts knowledge from an extensive body of previously experienced cases to create a model for classification of patient instances in a way that is both fast and accurate, then a decrease in the frequency of diagnostic errors may be achieved. What are the challenges to this problem? The first challenge is the large amount of data. The active participation of numerous diverse online populations and social networks generate massive amounts of data. This undoubtedly poses challenges pertaining to a large search space. Thus, any effective approach must be efficient and scale well. For the solution to be useful to medical personnel, it must also operate quickly so that patients can be accurately diagnosed without delay. The other challenge is multiple conditions. So many patients simultaneously suffer from multiple chronic conditions and thus present a myriad of symptoms. This means that each patient instance can potentially be presented by a large number of attributes. Furthermore, self-reported public records can potentially contain errors or be biased. What are the limitations of related work? On initial survey of recent literature, no results were found pertaining specifically to crowdsourced public health records from social networks being utilized for evidence-based diagnostics using Naïve Bayes classifiers. The area of study is in high demand, and research in the area will likely yield more publications as time passes. Let's now check out our approach. We utilize public health records that are maintained by individuals on social networking sites, such as patientslikeme.com, to obtain a large dataset of historic information pertaining to medical cases. We crowdsource the categorical sets of data dealing with symptoms of diseases and diagnose disease states in order to derive a model for prediction of disease diagnosis from a list of symptoms. We develop a domain-specific Naïve Bayes classifier and train the classifier with data obtained from social networking sites. Why do we use the Naïve Bayes classifier? Well, a large training set is expected due to the massive amounts of data present within social networks. Therefore, it is important that our approach be computationally fast and preferably require only one pass over the training set. Each patient instances is likely to be represented by a large number of attributes. For this reason, the ability of a Naïve Bayes classifier to scale linearly with the number of attributes is ideal. Despite its conditional independence assumption, they have shown to have good performance in several other domains. Our approach consisted of, we can be broke down into smaller steps. Here we'll go over a few of them. So the first thing we end up doing was we crowdsourced data from social networks. As mentioned earlier, we used patientslikeme.com. It's a site where data can be entered by public users. The only main disadvantage of it is, as mentioned earlier, it's entered by users, so it's possible that errors can be found. But an even bigger issue is that the data on the site is not easily exported. So to accomplish this, we moved on to our next point. We had to write our own web scraper. So we wrote a web scraper tool, pretty much pulls out information from the site in an HTML nugget format, and then we pulled out what information we need from that, information that was useful. The next point in our approach, we had to convert that data into something useful for our database. So initially, it was created in the format of MySQL. Later on, we end up using SQL to continue on with the data. And the last main thing we did was write the classifier. We did that. We wrote a domain-specific Naïve Bayes classifier in SQL. For our approach, we utilized 3 different tables. The first is a fact table. This is a table with calculated probabilities for each class, for each disease, based on initial data. This table included 10 different diseases and covered about 3,000 symptoms. The second table is the condition table. This is the table of the actual conditions. These include the actual conditions taken from the site before run through the classifier. It includes 8,000 plus patients. The third table is a symptoms table, which includes multiple symptoms per patient. This is the data to run the classifier and then checked against the actual conditions. Let's go through the validation process. So currently, our results are very preliminary due to loss of data when translating data from MySQL to SQL within SSMS Studio. Due to this, only a small portion could be accurately tested using the classifier written. So preliminary results reflected accuracy by comparing results predicted from the domain-specific classifier versus the real-life information, so the conditions table. The accuracy proved to be about 67 to 70% of the real life results. So that being said, there's still a lot that's left that's work in progress. And there's a lot to be accomplished experimentally completed before the final report is turned in. So this is some stuff that we're working on. So to work in progress, 65-70% will be increased once the entire data set is tested, instead of the partial result that we're only able to test so far. Results will be verified also using open source online tools such as Weka. It's a useful data mining tool. It can also be used to show support of our results. And efficiency will need to be evaluated. That's another important part of the overall results, showing that not only can we be accurate with the results, but as we mentioned earlier, produce results in a timely manner. So our conclusion. To conclude, we have seen the need for a way to diagnose and predict conditions based on multiple symptoms within the medical industry and elsewhere. We have shown that using public crowdsourced resources has valid uses in determining associated diseases. We have shown that Naïve Bayes can be used to predict conditions, yet is lacking in accuracy. Like we mentioned, that's one of the things that's working in progress. And overall, multiple attributes can make prediction a very complex problem, and there's work to be done in order to improve accuracy and show efficiency. These are our references. And thank you for your time. I hope you enjoyed the presentation.